Let's dive right in. In our bodies, managing fuel is one of the most critical jobs there is. And if you get this wrong, well, it's not just about a grade on an exam. We're talking life and death. So let's break down the absolute essentials of blood sugar regulation. Okay, so what we're talking about here is a really, really delicate balance. It's a system so vital that when it fails, the consequences aren't just bad, they're immediate. And no, that's not us being dramatic. A sudden, sharp shift in blood sugar can spiral into a full-blown medical emergency faster than almost anything else you'll see in your career. So why the intense intro? It's because getting a handle on this topic isn't optional. It's absolutely non-negotiable for keeping your future patients safe and for crushing those big exams like the NCLEX. And here's the thing, this really is simple but life-saving knowledge. Once you master what we're about to cover, you'll have the confidence to know exactly what to do when every second counts. All right, so at the very heart of this whole system, you've got two main players, two hormones that work in perfect opposition to each other. You can think of it like a constant game of push and pull to keep everything stable. And here they are, insulin and glucagon. This right here is the main idea you have to get down. Insulin brings blood sugar down, glucagon brings it back up. They're the perfect tag team. So let's start with glucagon and see how it works its magic. Think of glucagon as your body's emergency fuel release hormone. You know, when you haven't eaten in a while, or you're exercising, or even when you're stressed out. That's when your body calls on glucagon to make sure your brain and muscles have the energy they need. So how does it do it? It's actually pretty brilliant. First, glucagon sends a message to your liver, which is kind of like your body's sugar warehouse, and tells it to release its stored glucose. Then it kicks off a process called gluconeogenesis, which is just a fancy way of saying it makes brand new glucose from other stuff, like amino acids. It's a powerful 1-2 punch to get those sugar levels up. Now let's flip the coin and talk about the other half of the duo, insulin. This is the hormone that shows up to the party right after you eat a meal. Its one job, to get all that new sugar out of your bloodstream and put it away. And this is how it gets that job done. Insulin acts like a key. It literally unlocks the doors on your muscle and fat cells, letting all that glucose rush inside to be used for energy. And if there's any sugar left over, insulin helps pack it away in the liver for later. It's all about bringing your blood sugar back down to a safe, normal level. You see, this balance is everything. But what happens when this beautiful system breaks down? Well, that's when you get the clinical red flags that you, as a nurse, have to be able to spot immediately. These are the big three you absolutely have to know. With type 1 diabetes, the body just stops making insulin altogether. With type 2, the body makes insulin, but the cells just kind of ignore it. We call that insulin resistance. And then there's hypoglycemia, which is the exact opposite problem. Your blood sugar gets dangerously low, usually below 70. Okay, I get it. That's a lot to keep straight, especially when you're under pressure in an exam. So let's lock this in with a super simple memory trick that you can count on. This is it. This is all you need. Ready? Glucagon gives your body glucose. See? It raises it. And insulin puts glucose into the cells, which lowers it. Say that to yourself a couple of times. It's so simple, but it works every time. All right, now that you've got the concepts down and you have that awesome memory trick, the best way to really make it stick is to put it to the test. So if you're feeling ready to see what you've learned, I want you to head over to nursingwithcharity.com.ng. We've put together a practice quiz just for this topic so you can really solidify this knowledge. And of course, just a quick reminder, everything here is for educational purposes. When you're in a clinical setting, always follow your facility's protocols and the advice of your healthcare providers. Thanks so much for watching.